Welcome to the Diverse Minds podcast, where we give you the tips, tools, and techniques you need to be a mentally healthy and inclusive leader. Each week, you'll hear about a variety of topics linked to mental health, well-being, and diversity that will enhance both your professional practice and personal well-being.
Welcome to the 183rd episode of the award-winning Diverse Minds podcast. And as you know, this month's theme is all about representation and intersectionality in LGBTQ plus History Month. And this week, we're talking about public health from an LGBTQ plus and global majority perspective with the wonderful Harvey Kennedy-Pitt. Harvey, pronouns he, him, is an internationally educated scientist, a lecturer in a specialism of integrated public health education and a promotion practitioner. As a public health leader, Harvey's public health interests include addressing health disparities across communities of colour, particularly among those with racially and sexually minoritised identities. And in his role as CEO of Black Beetle Health, Harvey implements innovative public health approaches to community engagement, academic research, social wealth development, collective empowerment, and capacity building in order to tackle long-standing health disparities for LGBTQ plus Black and people of colour. As an independent public health consultant, Harvey helps stagnant professionals build capacity through adaptation using public health principles. Now completing his public health doctoral studies at the University of Chester in the Faculty of Health and Social Care, he hopes to continue to shed light on the ever-emerging evidence informing existing sexual health and wellbeing services for racially and sexually minoritized individuals in the UK. So Harvey, a very big welcome to the show.
Thank you for having me.
I'm really honoured because I know you're on the move and you're actually in Orlando at the moment. And so I feel so privileged that you have taken the time out to speak to us today.
No problem. It looks really interesting. I'm looking forward to speaking with you.
And so I've read out your bio, but I always ask my guests this question. Can you tell the listeners what you're working on at the moment?
Too much is what I would probably say. There's always loads to be working on. I think that, of course, within my consultancy work, I'm currently working on an ebook just to really focus on personal branding, which is going to be entitled Knowing Your No-Nos, because oftentimes I think we're so used to saying yes. And so sort of, taking time to think about what your no's are and maybe starting from there. So I'm excited about that. That'll be sort of completed by the end of March time. But I'm also, within my sort of wider work, obviously, I do run Black Beetle Health as a charity. And we're currently developing our Health Equity and Advocacy Training Academy, which is really exciting, and hopefully to have a conference later on this year. So there's always that as well. We have our podcast, our magazine. Certainly within equalities, wider equalities work in the system. I have my NHS work as well, which is focusing on developing the health inequalities framework to support the integrated care system. So always loads going on, and those are just some examples. But busy times.
Wow, and you find the time to eat and sleep. When?
Who does that? Who eats and sleeps? That's like old school. No, I absolutely do find the time. And that's one of the things that I do is help professionals to build capacity through adaptation so they can do, bits and pieces of what they want to be doing whilst also taking care of themselves. So, following my own rules.
Yeah, well, that's amazing. And what was your journey to becoming a public health leader and charity CEO? Obviously, you have two organisations. What was your journey? How did it grow? How did it all come about?
Well, I think it's really important to state that Black Beetle Health came about because the opportunities to do what I was interested in weren't coming up. I didn't see them. I didn't see anyone working on the things I was working on. And I had just finished the first year of my doctoral studies and realised, actually, I'm going to try and explore this further, but I have no way of exploring that because we have sort of maybe LGBT charities that are white-led or white-dominated, and we have maybe heterosexual, race-focused charities that actually don't create much space for the queer conversation. And so I said, well, we need an intersectional space, not just a project or a program of work, but we actually need a space that has its own parameters that allows concentrated work to focus on some of the intersectional issues across race and health and sexuality that really help us to grow. And try to lead on change. So it emerged. It was supposed to be an Instagram page. I was excited about this Instagram page. I was going to drop all the facts. This is prior to the pandemic, obviously, before it became really popular to sort of drop, posters and quotes and research and things. And people started saying, "Oh, could you send someone from your team to come and talk about the issues that you share?" I was thinking, my team, I haven't got a team, or someone from your organization. Oh yeah, that sounds very good. An organization, yes. And I realized that actually there was a need. what they were saying was that there was a need, and of course, we answered the call, and got our charity status later on that year. Started reaching out, calling in favors from people I knew. Different, could you sit here, or could you participate in this? And now we're a full blown operating charity. With a board of trustees and advisory board, and loads of different really exciting projects happening.
So exciting. I think that happens, doesn't it? Often when we start with our passion projects, it grows into something beyond what we expect. And we think, who's going to, I won't speak for you, but I definitely thought, who's going to listen to this? Like, who wants to know about race, culture and mental health? Lots of people. This is interesting because I feel like it's people like us speaking to one another. And how do we get, other people on board who may not identify as we do to see things from our perspectives?
Absolutely. And that's what happened.
Really exciting. And what do you think are the biggest challenges? And I know there are lots, but if we could just, if we can think about the LGBTQ plus community in its broadest sense and public health, with the pressure on the NHS, with the very odd shifting language around equity and equality, what are the biggest challenges that you're seeing at the moment?
Well, I think it's when we talk about prioritization frameworks and what do we do first and what's important, what do we keep, what do we fund, what do we defund, what do we let sort of disintegrate and maybe pick it up in our next 10-year plan because we just haven't got capacity. It's finding the capacity to do what's important to people first and then what's important to the system after that. And I think from an accountability perspective, that sounds like a really bad idea. From people who hold the accountability around how the system flourishes. But sometimes we end up choosing systems first and then forgetting the people that make those systems up. And so people's well-being declines, how people want to identify is ignored, the impact on their sense of self and their confidence and their capability is sidelined. And then we have to double back around in sort of 5 to 10 years and figure out how we can fix all these broken people so that we can upskill them to be upstanding members of the workforce again, and then we call ourselves heroes. So it's really about thinking how we can, and we call them upstream models of care, and it applies to LGBTQ plus people as well, as you mentioned in the wider sense. How can we figure out why people are falling into the river upstream rather than focusing how to fish them out later on and further downstream? So, when we think about the agendas like EDI, I would like to say JEDI, or EDI AJ, whatever you want to call it, we have to make room to prioritize these conversations, these agendas, these frameworks that support and advance our understanding of these experiences, because actually we're just members of the wider workforce. We just happen to be from this sort of this often marginalized group. So that's what my interest, my concern is how we can continue to make things and keep things priorities that we know need to be priorities, and link them up and join them up to other areas of the wider work we're doing, because it is important to keep them important and not forget them.
And thank you for that. And what do you think are the biggest challenges at the moment then? Do you think it is around, actually I don't even want to guess, but one of the things we know is access to mental health care for people. And then if we look at sexual orientation, how people identify in terms of racial identity, we look at poverty, or how people have access or don't have access to resources. I don't want to use this cliched phrase, but I don't know how else to put it together. It's just such a horrible situation, and it feels like a really nasty storm, I'm going to say. So what are some of the practical things do you think that could be done, and what role can workplaces play in trying to even out this lobby and even out this inequality?
It's interesting, particularly in the health and care sector, is that we always see it as we're trained, actually, and we're institutionalized to think that we are the helpers and then we're helping those that need help, when actually we oftentimes need the help ourselves. And I think the conversations around maybe mental health and well-being, maybe around capacity, today I'm struggling to cope today, or I need a break today, or I need a well-being day today, or I need advice. We're not encouraged to engage in such conversations because they're seen as being weak. They're seen as, but you're a doctor. You should know how to do that. You're a public health practitioner. You've got some strategies. You're an educator. You should know how to break that down. You're a strategic lead. You should be able to strategize your way. And we think those are jobs. They're not they're not the people. The people are doing those jobs. And so opening that conversation up to make it comfortable to say it's not going well, and for someone to say, that's okay, I've got you. How can I support you today? So we don't make conversations accessible in those ways. They come with the feeling of consequence, and it actually feeds historical practices that are based in hierarchy. And you come to me, I'll help you. You come to me, I'll give you the information that you need. You come to me, I'll signpost you to that service I'll refer you. And you're thinking, I actually just needed a chat, or actually I just wanted you to tell me how you've dealt with it in the past, or I want to know that it's okay for me to take a break and I'm not going to be seen as being weak. Yeah, I think that is some of the challenges that we experience, certainly within the health and care sector and wider public health arena as well.
Yeah, thank you. That's really, really helpful. And it gets me thinking a lot as well. Think about mental ill health, LGBTQ plus communities and culture, particularly the work that you do with Black Beetle. What do you think are some of the biggest challenges in accessing support when people are ready to get support, whatever that might look like? So, of course, we know that people don't, mental ill health can be a journey and recovery is a journey. As with physical ill health, we know they're not separate. They can often go together. But what do you think are some of the biggest challenges in people thinking, okay, I want help now. Where do I go? Where will I feel listened to?
Well, certainly what I've found in my doctoral research is that, we once believed that practitioners should be representative of the people that they're serving, and people should be able to go on Google and find someone who looks like them. And actually what I'm finding is not the opposite, but slightly different to that, where there is evidence that is really beneficial. Certainly we know that in a bedside, sort of in a clinical space, there is an impact of language, someone who speaks the same language as me, or someone who looks like me, I think for intersectional groups like sort of maybe LGBTQ plus people from racially minoritized backgrounds or from communities experiencing racism, I'm not trying to see my auntie in sexual health services. I'm not trying to see my uncle running mental wellbeing, because I might feel that I'm having to reveal something that's quite personal that they're not going to understand. And so the conclusion that I'm sort of seeing across sort of my research certainly is that people want to encounter good practitioners, people who are well-versed and competent in the experiences that they might be presenting with, who are comfortable navigating and talking about a range of issues without applying a lens of either faith or cultural expectations or shame, which is what comes up very, very clearly in my research. And I thought to myself, well, that's not what I expected to hear. I thought just everyone needed to be POC. They need to be people of color. They need to be people who are intersectional. But what people are saying is, at my point of crisis, I didn't care where Susie was from, to put air quotes in. I don't care where Kate was from. All I knew is Kate saved my life. Susie saved my life. Becky saved my life in that moment of crisis where I couldn't find somebody else. And I use those names because they're endearing words, almost, as you want to call them, of how we address people who we feel maybe from outside of our community, whatever it might be. So people are saying, give me a good practitioner. I really want someone who understands me and who's listening and who can just point me in the right direction to safety. So, yeah.
And as you were talking, I was thinking about translators, because this comes up quite a lot with me, that translators, particularly certain languages where people are going to be from very particular slices of community where people do know each other. They're terrified. They think, oh, sugar, they're going to go and tell my community, or they choose what to translate. This comes up quite a lot in social care context, in sexual health context. So as you were talking, I was really thinking about that. And I know I have a friend who's a family barrister, and she said it's really problematic. Yeah. But it's getting to that point of good practitioners, and practitioners from whatever walk of life perspective they're from, making the effort to deconstruct, reconstruct, or emphasize certain aspects to make people feel comfortable so they can support them in the crisis. And from an external non-healthcare perspective, that's what I often see as the hurdles.
Yeah, definitely.
So I don't know if your research so picks up on any of that. How do we get to the point when is good enough, and when is knowledgeable enough in terms of cultural capital and competence?
So we will never know everything. We will never understand everything. I think I was recently in a situation where I was doing a bit of consultancy for a client, quite a mixed group. I'm not going into too much detail because obviously they're clients. And I was asked to facilitate a space where I was not the majority. And I think within the conversation with our trans siblings and our non-binary siblings, we have to know when we are not the right people to be in that space, or we're not the right person to facilitate a certain conversation. And I think we find ourselves having to be back in the learning seat and say, actually, yeah, I haven't got a wrap on that particular that piece of knowledge, or I don't know enough about that particular thing. And this is the risk that comes up when we sort of say, oh, LGBTQ plus. Actually, there are so many experiences across that spectrum that you can't claim to know everything on all of those. So you actually have to bring other people in who have maybe more specific experience, or who can give particular insight. To ensure that we don't run the risk of speaking on behalf of somebody else, or maybe raising a topic, or a point of view that ends up being offensive, even in our knowledge, even in our expertise, and we think we're well versed. There's always lessons to learn, and so I had to learn some valuable lessons recently, even in the work that I do with some parts of our wider community, because I don't know all the answers. So I don't think we will ever know all the answers to anything. We never become the expert in anything, because actually expertise, I think, is transient. You can be an expert today and you can not be an expert tomorrow because new information has emerged. I think that you can know, air quotes, something at some point in time contextually, and then maybe not know it as well. Even doctoral studies are like that. When you submit your thesis, you're actually submitting it based on what you knew then. And it could be a year from then that it's completely different, but it doesn't negate the fact that you've gone through a doctoral journey. It just means that that's what you knew then, and that just captures a point in time. So it's just being comfortable with knowing and then not knowing, and then going on a journey to knowing again, or maybe not ever knowing. So
I think that's super helpful. And, again, I have made, I'm learning all the time. I've made, we all make mistakes. And I say that to people. I say, even as practitioners, we don't get it right. Like, we get it wrong a lot. And that's what we have to do, because otherwise we're not learning if we're not getting stuff wrong, right? And I think this is what, if I think about maybe not a non-healthcare workplace, or potentially, a healthcare workplace that's non-clinical too, or clinical, but is managers feeling terrified. Oh my gosh, I can see my staff member's not great. I don't want to ask them. In a training session, I had someone say, well, I don't really want to talk about sexual orientation because it's what happens in the bedroom.
okay.
Yeah. So, I mean, what do you think workplaces can do to talk about this connection between the very broad, as we know, people are individuals within the LGBTQ plus space, race and mental health, and the kind of connection? And that's not to say that people need to be experts, but if we think about, we don't want it to be transactional, but we do want it to be supportive. So at some point, managers are going to go, I'm so pleased you told me, but I want to support you, and this is how I want to signpost you. But it's getting workplaces to think about this in a holistic way. So what do you think workplaces could do? Have you got any good practice that you'd like to share?
Yeah, I think within the equality, diversity, inclusion, accessibility, justice space, which is that sort of acronym I used earlier on, is that we oftentimes think about that as all one thing. There are different words in that acronym and other acronyms for a reason, because it indicates that there is similarity but difference. And we talk about equality frameworks, equality, but we're not as good as using words like equity, which would require us to do something different, or adjust, what we give maybe certain individuals or certain groups access to, or it sparks a conversation where certain groups get upset and say, well, you didn't give that to this group, so that now puts us at a disadvantage. We know that within education, I used to teach as well. I used to be a science teacher for a secondary school. And we now know that even like white English boys are like the lowest achievers now suddenly, and well, not suddenly, but over the past sort of several years, has been gradually sort of moving into a position of being the lowest achievers. And people not start saying, well, now we've got to do interventions for white English boys. We can't have them falling behind. And we look at these really granular things, and we forget that there is a much broader conversation around the language that we use, how we approach things. What does it mean when certain groups appear to fall behind, or like, what does it mean to be behind? Or, so when we talk about equity, okay, we're talking about really shifting the way in which we look at what we think to be inequalities, or unequal, or, or fair. And think about things like inclusion, when we bring everyone around that table. How can we make sure that everyone's a part of that conversation, all perspectives are respected and acknowledged, that things are accessible when that information is conveyed, and that it ultimately leads to justice for everyone. I think that's what gets missed, because we think that I'm doing diversity, so I'm automatically doing all the rest. I'm doing equality, so I'm automatically doing all the rest. I'm working on justice, so I'm automatically doing all the rest. And it doesn't work that way, because they're all separate things that all have to sort of come together into a nice big melting pot of change. And so when I think about what workplaces can be doing, is thinking about how we address power in the workplace. Because if we address power in the workplace, suddenly, oh my goodness, you've addressed women's rights, you've addressed LGBTQ plus rights, you've addressed disability, you've addressed faith, suddenly you find yourself addressing all these things all in one, because really the issue there is power. And so we look at things like the theory of capital, which is by Pierre Bourdieu, who looks at social capital and cultural capital, and how people use these things like currency, okay, within spaces to either level up or advance, or become more notable by association, by what we're learning, what we have, what we seem to have, how we communicate, and think about how all these things, how they feed into power for certain people. When we address power in that space, suddenly we begin to know what we're addressing and how we can improve things. We make cultural capital more relevant to conversations. We start to ensure we include people socially, so they can rub shoulders with all the people who can help to influence and develop them. We start to see all these things working themselves out because we've addressed power in the first place. So that's sort of my perspective on that. That's the lens through which I see that. And there will be others who don't agree, or they might want to add to that. But that's certainly where I am in my journey of understanding, what are we doing here? What are we ultimately trying to recommend that our employers do for us? Or what are we asking? What would be the one thing that would change? And power is always my go-to. Let's talk about the power dynamic.
Yeah, thank you. Super helpful. And I think as well, it's understanding that people don't fit neatly. And like you said, they don't fit perfectly. None of us fit perfectly in a box. We are complex, and certain aspects of our identity will be more front and center than other aspects of our identity. And how we see ourselves and how other people see us again is often very different, or can be different. And I think it's addressing power enables that to be leveled somewhat.
Yeah,
but we know it's a journey as well. It doesn't happen overnight. So
that wasn't too deep.
No, it's brilliant. It's brilliant. So and you're an incredibly busy person, and you run lots of projects, as you told us. So how do you look after your own mental health? What are your top 3 tips?
Follow the advice you give other people. Okay. You go to the doctors, and you say, I'm feeling a certain way. The doctor makes a recommendation. We go away and we follow it. But you always ask yourself, okay, I wonder if the doctor does any of this stuff. You might be a mental health counselor or something else. You give advice to other people. You say, you should go away and do that. There's lots of advice floating about, and I think that if we all took a bit of the advice that we give other people, we'd all start to see the benefits. And I'm not knocking our lovely doctors or our therapists. I'm just using them as examples. So in public health, there's loads of educational tools and approaches that we use. When I take my own advice, I find that I'm in the best form of myself. And that means making time to look out the window, taking time to be mindful, to take notice, to learn something new. People talk about the 5 ways to well-being here. They're really, really simple things you can be doing. Connect with other people who bring you joy, people who support you, people who take time to listen, and you can take time to listen to as well. So reciprocate that. Take that advice. It's not advice for other people. It's advice for all of us. And when you implement that, you win. Everybody wins. People get the best version of you, and you're able to give the best version of yourself to other people.
Thank you. Anything else you'd like to share? That's it.
You've
got one tip.
Wow. Okay. So was it one tip? Oh man.
No. So it's your top 3 tips.
Top 3. Okay. So so take your own advice. Secondly, I think it's important for us to take time to reflect. There's something called reflective practice that I think many of us through the journeys that we've been through to who we are today have been asked to do along the way. Like, take some time and do some reflective practice. That might be through journaling. It might be through just, again, lean back in your chair, listen to the chair creak, okay, as it goes back, and you take time to reflect on what you just did or what you're about to do, and then move, then take the next action. We're just so busy back to back to back all the time. There's no time for reflection. Before you know it, boom, we're back in bed to start all over again the next day. And it's just, you think, oh my goodness, has that been 3 months already? Oh my goodness, I've been a year already. Yeah, it has been a year, and time can fly past, and you've not taken time to consider the actions that you're taking. So I think the first thing is take advice. Second, take time to reflect. Like, really take time to reflect. And 3 is always feed your inspiration. Okay, keep your inspiration topped up. Consider where your inspiration is coming from, whether you're a person of faith, or you're a person who enjoys reading or listening to ebooks or listening to music, or trying new activities, or feed your inspiration. Keep topped up. Always make sure that you're a little bit overflowing, because things are going to keep coming. They're going to keep coming your way. They're going to keep challenging you, keep pushing you. And when you don't have what to give, that's when we approach burnout. So staying inspired, protecting that inspiration is a big one.
Thank you. Those are brilliant tips. And I love asking that question, because very few people have exactly the same 3 tips. I don't think it's ever happened yet. So Thank you so much. And I burst out laughing with my mute button on when you said follow your own advice, because I've very publicly said on this podcast, I am great at supporting other people. I'm just not always that great at doing it myself. So yeah, you're absolutely right.
What happens,
yeah. And finally, Harvey, if people want to know more about you, your work, I will of course include all the links in the show notes. How should they contact you, and what are you offering at the moment?
So if you want to get in contact with me through my private consultancy, Unstuck, which is a new one, started back in April. You can contact me on Harvey at Unstuck, unstuck.co.uk, or you can reach out to me via @GetUnstuck by Instagram or other platforms like Facebook if you are a Facebook user. If you want to get in contact with me in regards to the charity work that we do through Black Beetle Health, you can do the same. So Harvey at blackbeetlehealth.co.uk, Beetle as in the bug, not Beetle as in the band. You can also find us on Twitter and so Facebook, Instagram, LinkedIn, Twitter, all platforms. If you want to get in contact with us regarding our podcast, our magazine, if you want to write an article, you want to be a guest, anything like that, you can certainly reach out to us by any of those means, and we'll be sure to get in contact with you.
Thank you so much. What a brilliant conversation, and really value your time. And this wraps up our intersectionality and LGBTQ plus history month very beautifully, but of course we know it's not a flash in the pan, so please remember it's about taking these lessons and using them 365. It's always a 365 approach. So Harvey, thank you so much.
You're very welcome. Thanks for your time.
Take care, everyone, and we will see you next month, where we'll be talking about women's history, women's activism, and women in the digital space. Take care, everyone. Bye for now.
Thanks for listening to the Diverse Minds podcast. Don't forget to subscribe on Apple Podcasts, Spotify, or wherever you access your podcasts from. You can also connect with me on Facebook, Twitter, and LinkedIn. Tune into next week's episode of the podcast, where I'll bring you more insights on mental health and inclusion. Bye for now.